The job description of LPN, licensed practical nurse, outlines a critical role in the healthcare system, acting as a bridge between patients and higher-level medical staff. LPNs deliver essential nursing care, monitor patient conditions, and provide support to registered nurses, RNs, and physicians. Their responsibilities span a variety of settings, including hospitals, nursing homes, clinics, and private residences. The practical and hands-on nature of the role makes LPNs indispensable in day-to-day patient care. Licensed practical nurses perform both clinical and administrative duties. While they do not have the same scope of practice as RNs or physicians, they play a vital part in ensuring that healthcare services are delivered smoothly and compassionately. The job description of LPN highlights the need for individuals who are not only technically proficient, but also empathetic, adaptable, and detail-oriented. With their ability to multitask and their dedication to patient welfare, LPNs form the backbone of effective nursing care in many institutions. Core responsibilities of an LPNs are tasked with providing direct, routine care to patients. This includes monitoring vital signs such as blood pressure, pulse, and temperature, and documenting these in patient records. They assist patients with daily living activities such as bathing, dressing, and eating, especially those who are elderly, recovering from surgery, or chronically ill. In long-term care settings, LPNs often build strong relationships with patients, giving them not just medical care, but emotional support as well. A critical part of the job involves administering prescribed medications and injections, dressing wounds, and collecting samples for lab testing. LPNs must follow proper procedures and adhere strictly to safety and hygiene protocols to prevent infection or other complications. They may also be responsible for setting up and monitoring medical equipment and alerting doctors or RNs to any significant changes in a patient's condition. The job description of LPN also encompasses administrative tasks, such as maintaining accurate patient records, assisting with patient admissions and discharges, and coordinating with other healthcare professionals to develop patient care plans. LPNs often serve as the first point of contact for patients and their families, answering questions and providing education on medical treatments or care procedures. In some states or healthcare facilities, experienced LPNs may supervise nursing aides or assistants, ensuring that patient care standards are met. They are expected to be vigilant and responsive, addressing patient concerns promptly and efficiently. In emergency situations, LPNs may be required to perform life-saving interventions until further medical help arrives. Essential skills and qualities of an LPN. PNs must possess a diverse set of skills to navigate their daily responsibilities effectively. First and foremost, they need strong clinical knowledge and hands-on nursing skills. They must be familiar with basic medical procedures, understand anatomy and physiology, and be competent in administering medications and wound care. A strong grasp of infection control practices is essential for patient safety. Equally important are soft skills, such as communication and empathy. LPNs must be able to explain medical information in simple terms to patients and their families. They must listen attentively and respond with kindness and clarity, especially when dealing with anxious or distressed individuals. Emotional resilience is crucial, as LPNs often work with patients who are in pain, undergoing difficult treatments, or nearing the end of life. Detail orientation is another key trait. LPNs must record patient information accurately and ensure that medications and treatments are given precisely as prescribed. Even a small error can have serious consequences, so attentiveness and diligence are non-negotiable. Teamwork is essential in healthcare, and LPNs must collaborate smoothly with doctors, RNs, therapists, and support staff. They must be open to feedback, willing to learn, and flexible enough to adapt to changing patient needs or workplace dynamics. Time management and organizational skills also help LPNs handle multiple responsibilities without compromising care quality. Education, licensing, and career path. To become an LPN, individuals must complete a state-approved practical nursing program, which typically lasts about 12 to 18 months. These programs are offered by vocational schools, community colleges, and some hospitals, and they include both classroom instruction and clinical practice. Subjects studied include anatomy, physiology, pharmacology, and nursing fundamentals. Upon completion, candidates must pass the National Council Licensure Examination for Practical Nurses, NCLEX-PN, to obtain licensure. Each state has its own licensing requirements, so aspiring LPNs must ensure they meet all the criteria in the state where they intend to practice. Once licensed, LPNs can begin working in a variety of healthcare settings. Many choose to specialize in areas such as geriatrics, pediatrics, or home health care. Some may work in correctional facilities, rehabilitation centers, or schools. With experience and further education, LPNs can advance to supervisory roles or become RNs by enrolling in LPN to RN bridge programs. Continuing education is often required to maintain licensure and stay current with medical advances. Many LPNs pursue additional certifications in IV therapy, pharmacology, or wound care to expand their skill sets and enhance their career prospects. Work environment and challenges. PNs typically work in fast-paced, physically demanding environments. They may spend long hours on their feet, assist in lifting or repositioning patients, and respond to emergencies at a moment's notice. Shifts can include evenings, nights, weekends, and holidays, particularly in hospitals or residential care facilities. The emotional demands of the job can also be significant. Witnessing suffering, dealing with terminally ill patients, or managing high-stress situations requires emotional maturity and healthy coping mechanisms. Burnout is a risk, especially for LPNs working in understaffed or high-pressure settings. Despite these challenges, many LPNs find their work deeply rewarding. They enjoy the opportunity to make a tangible difference in people's lives, often forming meaningful bonds with patients and their families. The demand for LPNs remains strong, providing job security and opportunities for growth and specialization. Conclusion: the job description of LPN reveals a role that is both challenging and immensely fulfilling. LPNs are crucial members of the healthcare team, delivering compassionate care, supporting patients in their recovery, and helping maintain the smooth operation of healthcare facilities. With a blend of technical expertise and interpersonal skills, they provide high-quality nursing care that supports patient dignity and well-being. LPNs do far more than assist doctors or follow orders. They serve as vital caregivers, educators, and advocates. The job description of LPN underscores their value in the continuum of care, especially in settings where patient contact is frequent and deeply personal. For those drawn to healthcare, looking for a career that balances clinical responsibility with personal connection, becoming an LPN offers a rewarding path. The job description of LPN emphasizes the potential to make a difference every single day, ensuring that each patient receives the attention, care, and respect they deserve.